good morning or afternoon to everyone, depending on where you are. Next slide, please. Before I launch into introducing today's panelists, two quick reminders or shout outs. One is that the Public Health Law Conference is coming up this fall. And so for folks who are interested in submitting an abstract, there's some information here and a link that you probably can't click on, so you could Google. But the deadline for that is February 6th, and would love to have participation from a broad array of folks. And then secondly, next slide, another reminder about webinar coming up Thursday, February 23rd from 1 to 2:30 on public health advocacy and strengthening that. So related to today's topic and building on some of what we're talking about today. Next slide, please. So quickly, I'll introduce the speakers and then we will hand it over to them. So first we have Katie Moran McCabe. She's a lead law and policy analyst with the Center for Public Health Law Research at Temple University's Beasley School of Law. She's worked on legal research and data sets regarding a whole variety of legal and policy issues, including the things that we are talking about today. Next slide. Joining Katie is her colleague Lizzie Platt, who's the Director of Research and Operations at CPHLR. She leads the center's involvement with this project, Act for Public Health, which I will talk to you about a little bit more in a moment, and she specifically manages the legislative tracking project. Then next up, we'll have Jill Krieger, who's the Director of the Network for Public Health Law's Northern Region Office. In addition to all the great work that she's doing with Act for Public Health and the tracking of bright spots, in particular, her current work involves climate adaptation and mitigation, the Farm Bill and agricultural policy, rural health, oral health, and a number of other interesting and exciting legal areas. And then finally, we will hear from Wendy Parmet, who's a leading expert on health, disability, and public health law. Wendy directs the Northeastern University School of Law's Center for Health Policy and the Law, and also holds a joint appointment with the School of Public Policy and Urban Affairs in recognition of her national leadership in interdisciplinary thinking and problem solving on issues related to public health. And she is going to talk a little bit more about specifically litigation that we are seeing. So quickly, just to set the stage, and then I will be passing it along, a little bit of context for this work. As folks are probably well aware, in 2020, as the pandemic unfolded, the public health systems and structures that had been in place really for many decades and largely had been operating for better or for worse behind the scenes to keep the public safe and healthy really quickly took center stage. And many people supported the measures that were put into place and understood what was happening on, but there was certainly a large and vocal, even if it may have been a minority, contingency of both the general public and policymakers who really took issue with what public health may have seen as the most basic activities. So masking, social distancing, vaccination, and this pretty quickly began to translate into a variety of effects and actions, media coverage, protests, attacks on public health officials, and really what we're going to dive into today in legislatures and governors' offices and in the courts, we saw policy changes and legal decisions that in various ways were seeking to undermine the power of the experts that were really most equipped to protect the public's health. It became intensely politicized, and decades-old structures were sometimes dismantled through really rushed and uninformed votes that were often knee-jerk reactions to what some politicians were framing as infringements on personal liberty, even though they were in service of the common good. So I mentioned the courts, we saw a mixed bag there too. Wendy will talk more about that. There were many judges upholding authority of public health officials, but sometimes veering from longstanding precedent to find overreach and rule in ways that may have effects both immediately and other broader implications. So this led a group of public health law organizations to join together to collaborate to try to take some of this on, provide resources, technical assistance, and training to push back against some of these attempts. And you see on this slide the names of those organizations. We've also partnered with folks like NACCHO, APHA, ASTO, the Local Solution Support Center, and others. So the speakers today are really going to dive into some of the work that we've been doing over the last year, what we've been seeing out in the field, what we've been tracking, analyzing, litigation, and also, as I mentioned, some bright spots. It's not all doom and gloom, not all doom and gloom. So I'm going to pass it along to Katie and Lizzie so they can dive in and remember to stick questions in the Q&A. Thanks.
Great, thanks so much, Sabrina. I'm going to start us off. I'm Lizzie Platt from the Center for Public Health Law Research. I'll be joined by my colleague, Katie Moran-McCabe, a little later to talk about our legislative tracking effort for the Act for Public Health. So our data that we'll be detailing here was just published to lawatlas.org on Tuesday. So please be sure to check that out to see more. Next slide, please. So first, I want to acknowledge some key partners in this work, not only among the Act for Public Health organizations that Sabrina just mentioned, but we've also collaborated closely with ASTO and LSSC in our legislative tracking work specifically. Next slide. So I'm not going to get too far into the weeds on the methods here as much as I may want to, though I'm certainly happy to dive in during the Q&A if you're interested. You can also check out our research protocols published with our data on lawatlas.org. But basically, we established a process to collect, organize, and code bills impacting public health powers from January 1st, 2021 to May 20th, 2022. So with our legislative tracking group, based upon initial reports from the Network for Public Health Law about these attempts to limit, or as Sabrina alluded to in happier instances, strengthen public health authority, we settled on organizing the legislation we are seeing into these 6 topical buckets that you see here. Public health authority limits, the reallocation of public health authority, state limits on enforcement of federal law, public health preemption, regulating public health measures, and legislation strengthening public health. Next slide. So in addition to organizing the bills into those topical buckets, we wanted to gather some standard information from each bill to capture for comparison. So most notably the bill status, which we narrowed down to these key time points: introduction, passage by the first legislative chamber, passage by the second legislative chamber, and then that eventual outcome, whether the bill was enacted, vetoed, or failed. Next slide. So we also asked a few sub-questions in some of these categories. For instance, in the public health authority limits, we wanted to see which actor's authority was being limited by the legislature. Was it the governor, state health officials, or the local health officials? And then, of course, how? Was it their ability to even issue an emergency order, the duration of that emergency order, or its scope? Or did it introduce a new way to terminate an emergency order, or even provide a pathway for a locality to override such an order? Next slide. So somewhat relatedly, we also wanted to dive into bills that were reallocating powers. Basically, is this bill taking a power that used to be under the purview of a governor, for example, and now giving it to the state legislature? Next, please. And then for our data sets that looked at legislation either regulating or preempting specific public health measures, we of course wanted to know the type of measures that were involved. So the ones you see here, like vaccine measures, testing, masks, school, business, and place of worship closures, like that. Next slide. So as I mentioned, all of our data are now live on lawatlas.org, where you can navigate to each of those topical data sets and really play around and dig in. So I'm going to walk through how to navigate these data quickly before getting into our findings, because as you will see, there is a lot going on. Next slide, please. So first thing to mention is that when you open an individual data set, you'll see at the top that you're able to download the data in Excel, along with a code book that defines those variables, but also that research protocol where you can go more in depth on our methods, of course, but also includes any coding or scoping rules and definitions that are helpful to keep in mind as you're looking at the coding. Next. So below that, you're able to use the questions on the left-hand side to query and see how that map changes on the right-hand side when you're on the Map View tab. So 2 key things to point out here. The first being that the yellow states will represent states that have one bill meeting that selected criteria. Purple states mean that there are multiple bills in that state meeting that criteria. And then you can also click on the exact state to see what those bills are. So the second key thing here is that this data is longitudinal, back to January 1st, 2021 through May 20th, 2022. So you can click on that tiny little time slider on the top left to change the date and see how the data will change over time. And you'll see the map change as you move along that timeline. And Katie's going to show you some more of those results in just a little bit. Next slide, please. So below the map, when you select a query, there will also be a table displaying the answer to your chosen query. Each bill will be on a separate row, and because we are lawyers, everything is, of course, cited. Next. When you click on that yellow section symbol button, you'll see a snippet of the bill that we use to cite. We use to answer that particular coding question, otherwise known as a pin cite. And then from there, you can click on the double section symbol that's circled there to see the full text of the bill. Next slide. And then where available, we have attached the full PDF version of that particular bill should you want to dive in even further. Next. So last thing to mention here on how to navigate the data, you can also navigate through the profile view, either by clicking on the profile tab or clicking on an individual state in the map. So doing so will bring up each bill organized as an individual card so that you can see each individual bill within a state or even compare multiple states at a time. Next slide. So now the fun stuff. As I mentioned, this data is observing legislation introduced between January 1st, 2021 through May 20th, 2022, supported by the bill tracking efforts of ASTO, the network, and the incredible coding talents of my team at the Center for Public Health Law Research. Next slide. So I say incredible coding talents because during that time frame, we saw 1,531 individual bills meeting our scope for those 6 topics that we tracked over time. Next slide. Of those 1,531 bills, 191 made it all the way through the legislative process and were actually enacted into law into 43 states and the District of Columbia. Next slide. So this graphic shows you the introduced legislation with the number of laws actually enacted, represented by that navy blue slice by topic. So while the amount of bills enacted by topic is relatively even, more or less, those slices are about the same size, there are some clear outliers in the number of bills introduced by topics. So bills regulating health measures being the clear winner with 1,197 bills. So with that, I'm going to now turn it over to Katie, who's going to dig more into these findings and our takeaways with some pretty maps. Katie, over to you.
All right, thanks so much, Lizzie. So first, I just want to share some of the results from our data set on bills regulating specific public health measures. Again, this includes things like vaccine measures, mask measures, school or business measures. So this map shows the states that enacted one or more bills related to vaccines as of May 20th, 2022. So there were 66 bills enacted in the states that are highlighted on the map. And as Lizzie mentioned, just as a reminder, the states in yellow enacted 1 bill, and the states that are in purple enacted more than 1 bill. Next slide, please. So in this slide, we have some examples of these enacted bills addressing vaccines. Some of these bills enhanced public health. For example, the New York Assembly Bill 8700 that made it a crime to falsify COVID-19 vaccination records. And then many of these bills restricted public health authority, such as the Utah House Bill 63 that requires employers to provide an exemption to vaccine requirements for people who have had a previous COVID-19 infection. Another example of a restrictive bill was the South Carolina House Bill 3126 that prohibited vaccine mandates for state employees and school children. Next slide, please. So this slide shows the progression of bills introduced regarding a specific public health measure. So just a note about the time frame. As Lizzie mentioned, we tracked bills that were introduced sometime between January 1st, 2021 and May 20th, 2022. So that was the whole universe of our project. If you look at the table on the right here, you can see the changes in the number of bills introduced in each particular measure. So for vaccine measures, that 501 represents the number of bills that as of January 1st, 2022 had been introduced the prior year. So since January 1st, 2021, there were 501 bills in that first year. Then as of May 20th, 2022, the number of vaccine-related bills grew to 691. And then you can see, looking down the table, the numbers associated with each of those particular measures. Next slide, please. So this slide shows some examples of the enacted bills limiting public health authority. There were 65 enacted bills as of May 20th, 2022. One example is Utah Senate Bill 195 that limits emergency declarations issued by a governor or a state or local health department by limiting the duration of the emergency declaration, restricting when an order can be reissued, and also allowing the legislature to terminate an emergency declaration. Another example is the New Hampshire House Bill 4440 that prohibits the suspension of civil liberties during a state of emergency. Next slide, please. So this slide shows the progression of bills introduced limiting public health authority. And again, we were looking at limits to a governor's authority, limits on state health official authority, and limits on local health official authority. So again, if you look at the table on the right, you can see the changes in the number of bills that were introduced, limiting the authority of each of those types of individuals. So as of January 1st, 2022, there had been 308 bills introduced since January 1st of 21 that would limit a governor's authority. And then as of May 20th, 2022, the number of those bills grew to 431. And then you can see going down the table there, the numbers for the state health officials and local health officials. Next slide, please. So here we have the progression of bills introduced that would preempt public health authority in some way. So in our preemption data set, we tracked bills aiming to block local authorities from implementing various public health measures like vaccine requirements, mask measures, closures at schools, businesses, or places of worship. So this graph starts at the beginning date of our project, so January 1st, 2021. You can see as of the start date of the tracking, there were no bills preempting local authority at that time. And if you look at the table, you can see by the next year, January 1st of 22, there were 63 bills introduced preempting local vaccine measures. And as of May 20th, that number increased to 93. And again, we have the other particular measures going down there. Thanks. Next slide, please. So as Lizzie mentioned, in addition to tracking bills that restrict authority in some way, we also tracked those that would strengthen public health. So as you can see on the map, 17 of those bills were enacted in the states highlighted here. Oregon House Bill 2927 is one example. That bill enhances organizational independence to health agencies. It also appropriates funds and increases expenditure limits during emergencies. And then another example is Vermont Senate Bill 1, which allows municipalities to adopt face covering rules during the COVID-19 pandemic. Next slide, please. So we wanted to share a few examples of some particularly frightening bills that were introduced, as well as just highlight some of the bright spots. For these concerning bills, one example, there's New Hampshire House Bill 1027 that sought to establish the crime of undermining the legislative process by false claim of emergency. This bill accused President Biden of colluding with OSHA under a false claim of emergency. There were several bills that either explicitly allowed for the prescribing or dispensing of ivermectin to prevent or to treat COVID, or that prohibited disciplinary action for prescribing ivermectin. On a brighter note, 12 states passed 17 laws expanding emergency authority. I'm not going to say too much about these because Jill's going to talk about this in just a bit, but we just wanted to give you a sense that there were laws enhancing state agency independence, for example, or increasing authority in times of emergency. There was a law amending the State's Administrative Procedure Act to authorize and detail emergency rulemaking procedures for state agencies. So there are some bright spots in all of this. And again, Jill's going to cover this in more detail shortly. Next slide, please. So just to share a few trends that we've seen in our tracking, the main target for bills regulating authority was vaccine measures. So of the 6 overall topics that we tracked, we saw the highest number of bills were those regulating a specific public health measure. And of those, vaccine measures were most commonly addressed, followed by mask measures. There were also many bills protecting civil liberties. So I mentioned the one example of the New Hampshire bill, which very broadly prohibited the suspension of civil liberties during an emergency. But then there were others that specifically regulated the right to worship, firearm sales, discrimination based on vaccine status. And we also want to note that many of these laws were specific to COVID-19 and many were not, and were generally applicable to any health emergency. So just to show a couple of examples here, Arkansas Senate Bill 590 prohibits mandatory use of a face mask, and Tennessee House Bill 575 that restricts when a county can implement a quarantine or isolation order. So this is not something that we specifically tracked in these data sets, whether a bill was specific to COVID-19 or generally applicable, but we did do some additional analysis on this and a few other issues related. And we have an article coming out soon that will go into more detail about this and some of these other issues. We've also talked about the possibility of specifically tracking this for our 2023 tracking, which brings us to our next slide. So what is next? We are gearing up to start our 2023 tracking, and we plan to continue tracking enacted legislation, covering the 6 topics that we've been tracking and that we've been talking about. The team may also be providing some technical assistance related to bill tracking. And we're currently refining our scope for tracking bills that have not been enacted. And one idea we're really interested in is trying to track the most important types of bills that are being introduced, both the negative and the positive. So that's something that we're exploring now, is how we can best do that. Next slide, please. So that's it from us. Here's the QR code that you can scan to explore the data. We encourage you to do that. Please check it out. And definitely contact Lizzie or me if you have any questions at all about the data. Thanks so much.
Great. Thanks so much, Lizzie and Katie. I'm Jill Krieger. I'll be talking about, as Katie alluded, bright spots in recent state legislation related to public health powers and duties. Next slide, please. So we know that there's been a coordinated backlash. 1,500 plus bills don't happen out of thin air, especially at such a rapid pace. And in addition to the tracking of the individual bills, We have also produced a resource that begins to look at some of those themes and provide additional analysis. And so that's, there was a network report where we looked at some of those core themes that Lizzie and Katie lifted up. Next slide, please. So in the face of a coordinated backlash, has there been a coordinated response from public health? And I think the answer is we're getting there. I think we're moving in that direction. And this slide lists some of the entities that have been working toward that coordinated response or that have been using a more proactive framework. You'll see probably an organization that you're involved with or a member of or in partnership with one way or another on this list. I think some of the really critical reporting and thinking and early groundwork has been laid in particular by the Bipartisan Policy Center, by the CDC Foundation with a series of webinars that they had last winter and spring. And I'm hopeful, and I think my colleagues at Act for Public Health as well, we're hopeful to continue to advance that conversation toward a coordinated response, really looking toward the future of public health and public health law. Next slide, please. So this is a favorite quote of mine from George Bernard Shaw. Think of the fierce energy concentrated in an acorn. You bury it in the ground and it explodes into an oak. There's some passage of time that may be involved, but I take that point when I think back to nearly 2 years ago when I was presenting on a webinar when we were noticing, beginning to notice some of these laws to severely limit and restrict the ability of public health leaders and staff and departments to do their job. This public health leader asked, well, what are the proactive steps that states are taking to strengthen public health and public health authority rather than simply react to threats to public health authority? And for me, that single request, that single question has been a clarion call, for the past 2 years, really guiding a lot of my thinking and research, and I think Act for Public Health's approach to these issues. So that's another reason for y'all to use the chat function and the Q&A function to raise those kinds of questions that can help move us forward. Next slide, please. Yeah, I think we really have to be asking, and it's hard. This is not meant at all as a criticism. I am so grateful to all of the many of you serving on the front lines over these last years in the face, not just of the biggest pandemic in a century and racial uprising and a climate crisis and on, and responding to an unsupportive at times public, or at least a sector of the public that was unsupportive. So I don't mean to suggest, why haven't you been thinking about your vision? But perhaps now we really can come together, think about our vision, define, clarify our vision for public health and the tools to get us there. Next slide, please. This is my attempt, looking, in fact, at some of the resources that some of those entities on my earlier slide have advanced about the kinds of attributes of a strong public health system. We need a public health system, first and foremost, that is effective and evidence-based, that is equitable and anti-racist. And there are a lot of other qualities as well, including, having access to the resources. But this is my attempt. I think we can refine this and crystallize it. But that we need a North Star as we're thinking, what's our proactive response? How do we build the public health system we need going forward? Next slide, please. One thing that I think about as a public health lawyer is the fundamentals of public health law. And so there's been a more recent edition of this book by Larry Gostin, the more recent edition. Lindsay Wiley joined as a co-author. but there's a foundational text in public health law by Larry Gostin that set forth this framework that I think is really helpful about the, just identifying tools of public health law. And I think when we've been, throughout the COVID pandemic, we've been thinking a lot about direct regulation, mask requirements, vaccine requirements, business closures. But if we step back and think about this whole toolbox of public health law, it can really open up a lot more opportunities where we may find more agreement and more support across the political and cultural spectrum, and be able to both tackle the challenge of infectious disease and strengthen the public health system more broadly. Next slide, please. So this is the category where we've been looking for exemplars of bright spots. Now, this isn't meant to be a comprehensive discussion. We're moving toward gathering more of these examples, figuring out what kinds of best practices we might be able to identify. But for now, in addition to those core public health interventions and emergency orders that have been the center of so much of our discussion about the COVID response, that's one of the categories of bright spots we're thinking about. But we're also looking at things like governance, funding, health equity, infrastructure, workforce. So those are the 6 that I'm going to spend the rest of my time really focused on. Next slide, please. So public health interventions, right. So we've been talking a lot about those: vaccinations, masks, access to PPE, closures of businesses, schools, and places of worship. But even within that set of direct regulation and those core public health legal interventions, we can expand the circle a little bit and look more closely at what have innovative states been doing around air quality, about indoor air quality, about ventilation systems. What about making it more possible to do things like have class outside, green schoolyards? What if we expand the circle and think about, there were a lot of bright spots these last couple of years in terms of expanding access, our broadband infrastructure, as well as access to broadband, and the use of telehealth, including the use of telehealth for opioid agonist treatment to address another public health crisis, substance use disorder. And then there's the entire set of social safety net interventions that were ramped up pretty quickly, not always, ideally, but at a bigger scale than we've really seen in this country in response to a public health crisis. Things like unemployment support, paid family leave, eviction moratoria. So there's a whole set of bright spots that we can look at in terms of those interventions. Next slide, please. Yeah, what else counts as a public health intervention beyond some of those, infectious disease focus, but what are the surrounding legal interventions that make it possible for people to comply with those business closure orders, et cetera. Next slide, please. In terms of funding, now this is a really interesting category, because when I had that list of entities that are looking at a proactive public health vision, there's one entity that I didn't include because I wanted to talk about it here specifically, and that's the Public Health National Center for Innovation, which is part of FAB, the Public Health Accreditation Board, and the work they've been doing with kind of pioneering states on public health modernization and foundational public health services. Because what I will tell you is that we've seen a number of breakthroughs related to getting more stable public health funding, less siloed public health funding in a number of states. And I've listed some of those on this slide, but those aren't, pandemic era legislation. They may have been enacted during the pandemic, but most of those have been years in the making. So what I would say to you is, if you're in a state that wants to increase your public health funding, you might want to look at these states and their work with the PHNCI and how they've been able to build the case and gather partners to provide those core foundational public health services. And I'll also say that Indiana is another emerging example that currently has a bill to expand funding for public health. Next slide, please. Health equity. Early on in the pandemic, not immediately, but fairly early on in the pandemic, there was a concern raised about disparities in terms of COVID, both morbidity and mortality. For example, the city of Milwaukee was collecting racially disaggregated data. And those disparities have continued throughout the pandemic. But again, states have responded, particularly in the context of the murder of George Floyd and the uprising nationally and globally in response to that ongoing concern, that ongoing pattern of police violence toward people of color. And so we've seen things, equity bright spots like state COVID equity task forces, like declarations of racism as a public health crisis, innovative strategies to address vaccine hesitancy, people of color's well-founded, in some instances and historically based, skepticism about vaccines or public health or governmental interventions generally, as well as strategies to increase access to vaccines in communities of color, in low-income communities, in communities that might not have historically or otherwise been as well served. And so, and one of those innovations is partnering with community-based organizations to increase services to communities experiencing disparate impacts from the COVID pandemic. Data collection, I think, and targeting public health interventions as informed by that epidemiologic data is a health equity bright spot. Increasing strategies, in addition to the funding for community-based organizations to address vaccine hesitancy and increase access to vaccines, are emerging strategies for equitable engagement of community members to share their lived experience to inform public policy. Next slide, please. Governance was one of the key elements in the backlash, and it must be part of our positive agenda for public health. How will we make decisions? How will we govern? And again, I would look at PHNCI, some of the strategies that have been part of these public health modernization and public health transformation efforts in terms of really thinking through anew how do we achieve that balance of an ability to respond quickly in an emergency and have transparency and have a democratic process. So some examples, some other governance examples include things like a number of states that have formed statewide commissions or task forces to really consider the public health system as a whole, maybe somewhat removed from the pace and the political pressures of a state legislative session. And we're beginning to see the fruit of some of those commissions, as I mentioned in, for example, Indiana, where there now is a bill really informed by that statewide commission, which was founded by a state governor's executive order. We've seen differences in how state health officers or local health officers are appointed and their relative freedom to take perhaps unpopular but necessary and evidence-based stands. And so looking at those protections for local and state health officers from perhaps the political, kind of hasty and ill-conceived political responses. Things like home rule. We've saw a lot of conflict throughout the pandemic, as noted by Lizzie and Katie, in between the state and local levels. So home rule is one strategy to ensure or protect the ability of cities and counties to take measures that are protective of public health, at least as to their residents, even if statewide there isn't support for those types of measures. Next slide, please. Infrastructure is absolutely critical. And when there's been chronic disinvestment in a sector, such as public health, the lack of that infrastructure can become, as we all saw, really problematic in an emergency. But we're again seeing states, we've seen, perhaps states we might not expect, like South Dakota and Oklahoma, invest in new state public health laboratories, investing in that core infrastructure to support the public health doing its job. We've seen tremendous federal funding, whether it's at the FFCRA or the American Rescue Plan Act, the Infrastructure Act. We're seeing increases in eligibility of telehealth services for both Medicaid and Medicare coverage, as well as private insurance, data modernization initiatives and policies. There's certainly more to do on the infrastructure front, but there are some bright spots. Next slide, please. Okay. Workforce, there are a host of workforce initiatives in terms of hero pay, basically incentive pay for those who took additional risk to, carry out their jobs and serve their communities. We've seen some states respond and to basically the threats and harassment of public health officials by protecting the private, the home addresses, phone numbers, cell phone numbers of those public health officials or government officials generally. A lot of strategies are coming forward in terms of workforce development, as well as attention to, the risks of burnout and the strain on mental health and well-being posed by being on the front lines. So things like policy and legal support for psychological first aid, as well as human resources of interventions like employee assistance programs. So that's kind of a lightning run through some of the bright spots that we've found. We're pulling all of this analysis together with an issue brief that'll be forthcoming, sometime in the next month or two is our goal. Next slide, please. How do we decide? Next slide, please. So we presented some of this information at the APHA annual meeting in Boston last fall. And one of the participants asked, well, how did the states decide which model to advocate for? And that's a great question. Next slide, please. And one of the things I would again suggest is that we go back to the fundamentals of public health law as an interdisciplinary practice and looking at the evidence. What's the evidence of what works? What reduces morbidity and mortality? What's the evidence of what can garner enough political support in states like yours, similar to yours? What have lawyers told us about how to design these legal solutions? And what are the communities telling us about what they need and want? And can we enforce and implement this? So those are some of the top level answers. But that's one of the things that Act for Public Health can also work with you on, is identifying some of the bright spots and figuring out which might be most suitable in your jurisdiction. Next slide, please. Because we're all looking for that one that's going to be just right for our state, our community, our tribe, our country, to have the best public health system we can. Next slide, please. Yeah, this is one of my favorite songs. Just wanted to share this, that it can take some effort to find that just right intervention. What we're doing at this point is trying to identify some bright spots and then begin to find ways to spread those, even if every state or community might not look the same. Can we all move towards some of that broader vision using all of the tools in the public health law toolbox? Thank you. Next slide, please. Just my contact information. Thank you, and pass it on to our next presenter.
Thank you so much to all the organizers of this event, all of our partners at Act for Public Health. I also want to thank my colleague, Faith Kallick, who spearheaded some of the research that I'm going to be reporting on. So next slide. So briefly, my presentation is going to turn the page a little and talk a little bit about the litigation that has gone on relating to public health authorities over the last 2 years. I'm going to talk about the early cases, our studies, and what it all means for public health. Next slide. So I'm going to report on 3 different studies that we've done. The first one was a review of 53 decisions in the spring of 2020 at the very early days of the pandemic. These were cases that cited to Jacobson versus Massachusetts. Talk about that in a minute. Secondly, a larger review that recently published, and we'll show that in a minute, of over 1,000 public health authority related judicial decisions. And then a more recent follow-up on vaccine cases that have happened since July. Next study, please. So one short answer is there's been a lot of case law, right? Just a lot of cases have been brought. Interestingly, the majority of decisions come from federal court. And there's been a wide range of legal challenges brought to various public health laws during the pandemic. The largest category of challenges is due process. Those are both substantive and procedural due process. Those include privacy claims. Equal protection is the next largest category. A lot of free exercise claims, and I'll talk about them in a minute because they've been so important. Scope of authority cases, including several that have reached state high courts, and a variety of different administrative process claims, administrative procedure claims. Next slide, please. So lots of different public health orders have been challenged since the start of the pandemic. Not surprisingly, the challenges follow the orders. So early on in 2020, we saw a lot of different challenges and a lot of judicial decisions about social distancing measures. And we're defining that to include travel bans, business shutdowns, limits on gatherings. More recently, as many of those orders were lifted, we have seen a lot of litigation about mask mandates and vaccine mandates, and the vaccine litigation in particular continues. Next slide, please. Thanks. So, as I mentioned, the first look of this at this issue and what the courts were doing and how the courts were responding to the pandemic was a study that we did in early 2020, and we looked at cases that cited Jacobson versus Massachusetts. And the reason for that is the 1905 Supreme Court decision has long been considered the leading public health law case, especially with respect to the government's ability to control infectious diseases. In the spring of 2020, as states and I should say local governments also imposed a wide range of social gathering laws, shutting businesses, banning gatherings, banning in-person worship, litigants went to court seeking injunctions. Most of the courts relied on, or at least cited, Jacobson versus Massachusetts. But importantly, courts disagreed about what Jacobson meant and what it compelled them to do. Some courts, such as the Fifth Circuit in an early case called Abbott versus Texas, which challenged Governor Abbott's ban on abortion during the pandemic, read Jacobson as meaning that ordinary judicial review should be put aside during a public health emergency. In a sense, the judicial review, normal rules of judicial review should be suspended. Many other courts said, first, We'll give some limited judicial review under Jacobson, but just to hedge our bets in a sense, we'll do the two-step and see if the order at issue would pass the regular forms of review. So I call that the two-step. And in most cases, but not all, courts upheld the public health order. On May 29th, 2020, the Supreme Court issued its first COVID decision in South Bay United Pentecostal Church versus Newsom. Like all of the Supreme Court's COVID cases, it came from the court's emergency or so-called shadow docket. And that's where the court issues emergency orders without full briefing and usually, although not always, without any oral argument. In the case, the court by a 5-4 vote refused to block on free exercise grounds California's limits on in-person worship. There was no majority decision, as is often but not always the case in shadow docket cases. But Chief Justice Roberts wrote a concurring decision which stressed that courts should give deference to politically accountable actors in matters of public health, and he relied on Jacobson for that. Next slide. In late October 2020, Justice Barrett joined the Supreme Court, replacing Ruth Bader Ginsburg. Less than a month later, the court adopted a very different approach to the COVID litigation, enjoining New York's cap on the number of people who could worship in COVID hot zones, as the order called it. I'm not going to go through everything about this case. It's a complicated case, but I want to make a couple of points about it. First, in this shadow docket decision with a majority opinion, the court did not cite Jacobson, and it is not cited to Jacobson since. So in one sense, one thing we've seen is that Jacobson, long the leading public health law case, has been sidelined. Secondly, the court applied what I like to call strict scrutiny to decide whether strict scrutiny was required. In so doing, it emphasized that some secular activities, such as train stations and acupuncture facilities, were regulated less strictly than worship. Therefore, according to the court, the state was not treating religion equally to comparable secular activities. Critically, in deciding what was comparable to what the religious activity at issue, the court did not look at any public health evidence. Indeed, public health evidence just did not play a role. And once the court found that strict scrutiny was required, it found that the New York order failed that high bar, saying that the state could not justify the ban, in part because it could not show that the particular religious facilities at issue had actually been the source of outbreaks. In other words, and I think this is problematic, the court is basically saying you can't do prevention when strict scrutiny is used, right? You have to be able to show that an outbreak has already happened. And secondly, the court noted that other states managed to have less strenuous regulations, therefore New York didn't meet its regulation. Next slide. The change that was wrought by Roman Catholic Diocese versus Cuomo had a significant effect on free exercise cases moving forward. But I do want to stress that even after the Supreme Court shifted its approach to COVID litigation in November 2020, it's still important to remember that overall, most decisions by most courts supported the exercise of public health authority. Nevertheless, there were some significant, and especially at the Supreme Court and from some courts of appeals, decisions that ruled against public health. Next slide, please. So one particular area where we have seen this change has been in the evolution of free exercise law during the pandemic. Before Roman Catholic Diocese, most challenges to state public health laws that in some way implicated religious liberty were rejected under the authority of both Jacobson versus Massachusetts, which was not a free exercise claim, but the Supreme Court had cited frequently in other free exercise cases, and or Smith versus Employment Division, which held that laws that were neutral and generally applicable as to religion are subject only to rational basis review. Roman Catholic Diocese showed that even in a pandemic, public health laws, if they are subject to strict scrutiny, might not survive strict scrutiny. But because the New York order at issue specified religious worship, the case did not necessarily clash with Smith, but subsequent cases did. First, and most notably, in April 2021, the court in Tandem versus Newsom held that a California law that limited gatherings, the size of gatherings in private homes was unconstitutional as applied to plaintiffs who wished to gather for Bible study and worship. Critically, the law said nothing about religion or worship or Bible study. It just limited the number of people who could gather out in a private home, limiting, poker gatherings or cooking clubs. Still, the court found that because the state regulated retail shopping and some other secular activities less stringently, the state had regulated comparable activities more favorably than religion. Again, as in Roman Catholic Diocese versus Cuomo, the court did not look to any of the public health evidence that was in the record in determining the comparability. And then the court went on to say that the order failed strict scrutiny. Then in June 2021, the court decided Fulton versus City of Philadelphia. This was not a COVID case. This was a case about the application of Philadelphia's anti-discrimination laws to a Catholic charity that refused to place children for adoption and foster care with same-sex couples. But in looking at that conflict, the court held that strict scrutiny is required whenever officials have discretion to grant a religious exemption, but do not grant it. So the very maintenance of discretion itself, the very possibility, allows for strict scrutiny. Next slide. This proved impactful in litigation over COVID vaccine mandates. Without going through all of the cases, a few points are worth noting. First, despite the changes, at least 3 circuits have held that the lack of a religious exemption is not unconstitutional. However, some lower courts and some dissenting Supreme Court justices have said that if a state vaccine law has a medical exemption, but not a religious exemption, strict scrutiny is required. And they have gone on to say that once strict scrutiny is required, vaccine mandates for COVID vaccines at least may not be constitutional. Second, challengers have actually fared better. And this might seem a little paradoxical, challenging vaccine mandates that allow for religious exemptions when they are denied their exemptions. And that's because of Fulton, and that's because of this idea that once there can be an exemption, the failure to give it may trigger strict scrutiny. And again, some vaccine mandates have failed under strict scrutiny. Also, but importantly, I want to stress that the Supreme Court has not entered this fray in general. It has not struck a state vaccine mandate, despite the fact that there have been several petitions asking it to do so. So it has, in a sense, unsettled the law, but it doesn't seem to be eager to go all the way and strike state vaccine mandates. However, the Supreme Court did intervene in one case, Austin versus U.S. Navy SEALs. This is a case in which And kind of shocking, right? The Fifth Circuit ruled, and there have been several others, that the federal vaccine mandate for, in this case, Navy sailors, was unconstitutional, violated the Religious Freedom Restoration Act, which required strict scrutiny. But the Fifth Circuit went on to impose a very broad injunction against the Navy, and the Navy went to the Supreme Court, and the Supreme Court, without overruling the decision, did narrow the ruling to allow the Navy to still make personnel deployment decisions based on vaccine status. So, next slide. A critical question is, what are the implications of all of this for childhood vaccine mandates? The cases that I've talked about have opened the door to new litigation over childhood vaccine mandates. Or to put it another way, a once very settled area of the law is now at least potentially unsettled and uncertain. Still, it's important to note that to date, no court has found that childhood vaccine mandates are unconstitutional. And no court has held that state childhood vaccine mandates have to have a religious exemption. But just before the end of the new year, the Second Circuit, in an important case, the Second Circuit refused to dismiss a challenge to a New York law that did not have a religious exemption and allowed keeping a child who was unvaccinated out of school during an outbreak. And the court sent it back for a full trial. Next slide. Another critical development has been with the so-called major questions doctrine. Most public health statutes, especially those that grant emergency powers, have included broad catch-all phrases, broad catch-all grants of authority. For example, allowing the health agency to take such actions as may be reasonably necessary to protect the public's health. Traditionally, courts have read these statutes broadly and have upheld exercises of authority under them. The Supreme Court and some state courts will no longer do so, at least when the regulation or order relates to a so-called major question. Relying on the theory that agencies should not be able to exercise authority over issues with significant political or economic import without explicit statutory authority, the Supreme Court in 2021 blocked CDC's eviction moratorium. And then in January of 2022, it used that same reasoning to block OSHA's vaccine mandate case. It also decided CMS's vaccine mandate case, but did not overturn that. Lower courts have used the major questions doctrine to limit a lot of different federal rules, including CDC's transportation mask mandate, federal contractor vaccine mandate. So there's a lot of litigation. Critical question that's raised by this line of cases, which the Supreme Court, I should say, also used last June to strike the EPA's clean energy order, is what is meant by a major question. The court has not exactly told us that. So let me end with a few takeaways for public health. First, in our paper, and I thought we had the QR slide for it, but I think it's not, so maybe I can put it in the chat later. In our paper, we offer a few takeaways for public health practitioners. First, public health still wins most cases. And despite the change, public health wins way more than it loses. Officials should not forego issuing orders when they are necessary. Okay, so that's sort of again, but following up on Jill, there is some good news here. But public health needs to know that it can no longer assume or count on getting a lot of deference from courts, especially, but not only around religion. Public health needs to have well-developed procedures. Public health agencies should have well-developed procedures to grant or deny any religious exemptions that are available. They need to make sure that the process is fair, that it's well conceived, and that it is not unduly burdensome. Anything that looks in the least way as if it's punitive to its religion is going to may face the judiciary's wrath. Another takeaway, which I think is really important and hasn't been talked enough, is the need to commence rulemaking, however that's laid out in a state APA Act, as soon as possible. In the early days of a public health emergency, officials have to issue orders. There is no time to engage in rulemaking. But as time goes on, as months turn into years, and we're now sort of coming to the third year of the pandemic, officials should move to codify their orders or explicate the criteria for when they will issue orders and when they will not through rulemaking. A lot of the different cases we've seen, and back to one of the earlier slides, you will have seen that plaintiffs succeeded at a higher rate in cases about administrative procedures than any other. So rulemaking can be really important here. I should note that the fact that the CDC continued to rely on an emergency order to support its mask mandate for quite some time was actually a significant point in the oral arguments before the 11th Circuit last week in the mask mandate case. Finally, persuasion and communication may be more important than direct regulation. It's important to remember, as Jill told us, that mandates are not the only tool in the toolbox. There are lots of other ways that public health, through persuasion, incentives, there are lots of other ways that can sometimes work to achieve public health goals. And when they may be successful, we need to think about them, because mandates can provoke a backlash. And the receptivity that we're seeing among many courts, although definitely not all, to legal challenges, in a sense, helps to fuel that backlash and legitimizes it. So be careful and try to avoid mandates, but when they're absolutely necessary, don't be afraid to use them. Thank you.
Thank you, Wendy, and thanks to all of our wonderful speakers. I work on this stuff every day, and every time I hear you, I continue to learn. So and thanks to everyone participating in the chat, things flying back and forth fast and furious, and the questions. I'm gonna run through a couple of just resources, links, other things that we have available, some of which tie into some of the questions that we've been getting, and then we should have some time for Q&A, and we can also follow up with folks individually after the fact. So quickly through the resources, what you see here is the Act for Public Health website. If you have additional questions about this or want to dig into it more, or at least the vast majority of the resources you heard about today and many more are sort of centrally located at this website. Next slide. This is just a little taste of what you'll see there, but there's a lot more. The link is there, but you also see Sarah has put it in the chat. Next slide. Another thing that's on that website is just some FAQs. So general overview of some of the primary issues here, if you're trying to talk to others about it or have questions about some of the fundamental issues that we're seeing, they are here. Next slide. One thing that's come up a lot in the chat and also in the Q&A is this issue of advocacy. And so let me just say a little bit about what we're doing about this. And then I think at the end and in the chat, there have also been many plugs for the upcoming webinar that's focused all on this issue. So I would really encourage those of you that want to talk more about advocacy, ask questions, get engaged in that conversation, to join that webinar. Details in a second on another slide. But some of the other things that we have been doing are trying to really train people on what's okay. I think there's a lot of fear about what about advocacy and sort of crossing that line into lobbying and rules that employers or grants funders might have about getting involved in lobbying and advocacy activities. So we have done several trainings on this. The one you see on this slide is a webinar that you can access. There's a slide deck there that really walks through like what is lobbying, what are advocacy activities that never constitute lobbying, sort of how can you understand those differences and what are some ways to get involved. And then also recognize there's sort of a broader conversation to be had about like just fear of getting involved in that because of employer rules or just the politically charged environment that is probably going to come up on the next webinar. Next slide. Just a few more resources that we have on the ChangeLab website. You'll see here there's some fact sheets. Next slide. Just some categorization of what we've been seeing. So like really high level overviews of what you heard about today, if you can use resources to sort of share with other people or for your own self to remind yourself. Next slide. Another thing that's come up and it's related to advocacy is this issue of messaging and communications. So we worked with partners at BMSG and Real Language to develop strategies for messaging about public health authority, recognizing the picture that's often portrayed in the media. And we really wanted to equip ourselves, but also the folks that we work with tools to talk about these issues. So next slide. You can see there are two specific resources. There is also a webinar recorded on our website that you can check out that's all about messaging and framing. And then next slide is BMSG wrote up a report on this issue too. So if you want to dig more into that. Last bit of resources, just here you can see categorized some of the various things that we can offer. If we, like I think Leslie put in the chat, if we can't get to your question today, we do have a TA form that you can fill out. Next slide. There are two QR codes here, but we can also, I know I'm moving quickly. I want to get to the questions. So we can put a lot of this into the chat for folks to take a look at. Two quick shout outs, and then I want to do a quick poll actually, and then we'll take questions. So once again, Public Health Law Conference, just a reminder to submit abstracts for that. And then probably of great interest to a lot of you, next slide is this webinar that is on this advocacy issue that is coming up so often in the chat. So quick poll on what folks would like to see. We are here to do more training and impart more information on all of these issues. So we're hoping to hear from you. What would you like to hear more about if we were to do additional webinars, et cetera? So if you can take just a second to participate in the poll, that would be great. And then I'll ask my fellow panelists or my colleagues to come off, to come onto camera maybe, and we'll do a round of, we'll see how many questions we can get to. Great. Okay, why don't we launch and people can finish up the polling while we get started on questions. So I know there's a number of questions that came in the chat and on the Q&A that have been answered in writing. So I'm going to try and track a little bit here between the ones that have been answered and ones that have not been answered, or we may have some repeat here, but and some that maybe be interesting for folks to hear about. Let me start, I guess, with this one. A lot of the bills that we're seeing and that you all talked about were, that we're seeing and are sort of related to what we've talked about are not directly related to COVID, but are sort of COVID inspired. And I think that's true, not just, it's true, like, we are very aware of that. But I just wanted to hand it over to my colleagues to talk about, like, are we tracking those? What's to come in that space?
Yeah, no, thank you. And I also want to give a shout out to all of the great dialogue and conversation and points that have been brought up in this chat. I've been trying to just take notes because I think all of your suggestions and ideas are right on the money and what we're considering going forward for our tracking. I know that when we were sort of doing this bill tracking, we started to notice that, yeah, we're seeing a lot of specific to COVID-19, but then we're seeing some scarier bills, right, that could have a broader implication beyond this. And I know more recently we were seeing some bills that are eroding the ability of school administrators to even issue immunization for childhood vaccines, which is not COVID specific, but can have a much more important public health impact, and that's for sure. So I think as we move forward and transition into 2023, having a specific question related to this to suss out what are these broader applying bills will definitely be at the top of our list.
Thanks, Lizzie. Wendy, this might be for you. There's a question about looking at tribal cases and whether and how state cases might have impacted tribal jurisdictions or vice versa. Is that something that's on your radar?
Yeah, unfortunately, that was not in our study. We looked at state courts and federal courts. We note that as a limitation in the article that I put in the chat. It's really an important issue and would love to look at it, but we did not cover tribal cases.
Thanks. Again, for Lizzie and Katie, or maybe Jill also, there's a question about evaluating the potential effect of all of these bills and changes on BIPOC populations. Does anyone want to speak to that?
I can start and then hand it over to Katie and Jill. I think that is definitely another focus that we want to keep in mind. I think it's an important angle for this. We did want to initially try to track the equity implications of many of these bills, recognizing that that is a huge piece of all this. So I do think that is something on the table for 2023. And the other nice plug that I guess I'll throw in is that our data is available for download. So don't feel like you're limited to only these takeaways that we're giving you. You can definitely reach out and collaborate with us or work with our teams to work on some sort of niche evaluation using this data to support that. But I'll hand it over to Katie or Jill for other thoughts as well.
Yeah, I'll just quickly echo what Lizzie said. It's definitely something that we discussed in the tracking that we just released and thought about how to sort of best capture equity implications. So definitely on our radar and something to think about for this year's tracking. So thanks for raising that.
And I'll echo Lizzie and Katie and say we absolutely are actively, both within the context of this public health authority work and kind of our within the Network for Public Health Law, our health equity team. Dawn Hunter is the director of that. We are actively tracking. I mean, first, it's the things like data. I mean, and we have a data team in our Mid-States region who just did a terrific webinar on data disaggregation to really understand some of those equity, really delve into those equity implications and get the raw data to begin to even inform our policy. So really commend that webinar. It was just in the last week or two. And then, yeah, we've seen, and this is a high profile and high priority issue. The National Governors Association had a report on some of the COVID health equity task forces. My colleagues, Dawn Hunter and Betsy Lawton, had a published law review article on the COVID health equity task forces. And then more broadly, moving forward, there was a flurry of declarations of racism as a public health crisis. Oh dear, just got a battery low warning. That's strange. I think I'm plugged in. Anyway, better wrap up in case I do die. Not me, but my computer. Little comic relief here. But no, I think there's lots of work to be done. We're seeing it, part of the problem is that communities of color are more affected by adverse air quality or, Superfund sites. even without regard to race, without regard to income, excuse me. So we need strategies like Washington State just passed their HEAL Act to direct climate-related investments to the most impacted communities, especially including communities of color. We're seeing initiatives to address racial trauma, again, in the wake of the murder of George Floyd and racial trauma upon racial trauma. So initiatives to directly address mental health. And my colleague April Shaw has been working on, the move toward mobile crisis response and how can we translate our suicide prevention and response more to a public health approach than a law enforcement approach. So tons and tons of legal strategies and ways to advance racial health equity. I mentioned my colleague Dawn Hunter. She's working, some of our network colleagues are working with a lot of colleagues here on the webinar as well on a collaborative on anti-racism that's meeting quarterly. So feel free to follow up with me or with the network generally to learn more about that collaborative as well as a way to plug into health equity efforts.
Thanks, Jill. I realized I forgot to do, there's a second poll question, so maybe we can launch that while I'm sorting through the many excellent questions, and you can answer the how. I covered the what, but I neglected to include the how. So if you are able to just quickly weigh in there, that would be great. I think there's a set of questions here that I'm going to group together. I think not totally artificially around about maintaining hope and also like moving forward model legislation, etc. I will weigh in quickly and just say I listened to Jill's presentation to maintain hope. Sometimes that's why we include that whole piece about bright spots when we take this show on the road to talk about this work, because it can be pretty heavy and sort of not very uplifting and hopeful. That said, I think as a group, the Act for Public Health group, are taking the opportunity, though, I don't think COVID is not fully over, but I think we moved from like a very acute phase to a more ongoing phase to really think about what's coming next and how to move forward from here and think about how we frame, talk about, work on public health infrastructure and authority, like with this positive frame. What would we like to see and how do we get there, rather than just putting out the fires that are coming at us fast and furious, or have come at us fast and furious over the last 2 or so years. So there's a question about model legislation. I think, yes, that is also on our radar. How do we translate some of what we're seeing that's happening that's good into resources that all of you working on the ground can use? So resources for city, county council, for legislators, et cetera. So I just wanted to say that's both on our radar and also in our planned work for the upcoming year. So stay tuned on some of that. Maybe we'll be having a webinar on that later in the year. Let's see, there are some specific questions here around, probably for Lizzie and Katie, around overlap in the scope of limitations among the bills, meaning like what are we seeing in sort of throwing the kitchen sink into one bill. There was another question that maybe you answered in the chat here. Why don't you go for that one and I'll sort through here and see if I can tag on.
Sure. So yeah, that's a good question. So there were definitely bills that covered multiple issues. So maybe limiting governor's authority, also shifting authority to the legislature, that kind of thing. And where we saw those bills, we did include those in each data set where it applied. So it's possible that a bill might be included in multiple. It is true that some bills are included in multiple data sets.
Thanks. There's also a question about live tracking and advocacy. I think, Liz, you answered that, but just to say out loud, and I'll let you speak to this too, but yes, we are very aware of that. We get some sort of real-time information from various partners and sometimes are reaching out to folks in the field as that's happening, but I don't know that we have it like posted anywhere. This is certainly a place where if you hear of things, we would love to hear from you and we would be happy to provide technical assistance also. But Lizzie, do you want to add to that at all?
Just echoing that and saying that is our dream. That is where we are heading towards. That is what we would love to be doing. We're adjusting our methods. As I mentioned, we use a process, and I'm not going to get into all of it, called sentinel surveillance, to do this as quickly as possible, but with as much quality control as we possibly can to get things out quickly. But the other exciting thing that we're looking towards is using some of our technology to help us, whether it be with machine-assisted learning and coding, so that our poor little coding fingers aren't doing all 1,500 of those bills. But yes, right there with you. Want to see that soon as well.
Thank you. There's a question here. I'm not sure if folks can answer it, but around legislation around confidentiality. Is that something that's come up for you all in tracking, or Jill, or even Wendy in litigation? Seems like maybe not.
We haven't tracked that. It's obviously super important, but it wasn't in the scope of our tracking.
Another question, maybe Jill wants to speak to this, and I know we're running short on time, but what about any perceived or actual nexus between climate change and some of the emergency response stuff that we're seeing, disaster management in current or proposed laws, or the changes we're seeing?
Thanks, Sabrina. That's serendipity. I was just adding a link in the chat. Sure. I mean, a couple links. Poor air quality, whether it's high particulate matter or whatever the case may be, leads to a host of health problems, whether it's asthma, respiratory illness, cardiovascular disease. So anything we can do to drive down, particularly particulate matter, like transition to renewable energy and away from fossil fuels, that was the #1 recommendation of a U.S. policy brief associated with the recent U.S. Lancet countdown. So that's one place to start. And obviously, maybe not obviously, but huge racial equity implications there as well.
Yeah. Well, I think we're at time, and I want to be respectful of everyone, both panelists and participants' time. So I just want to thank everyone, the network for hosting us, everyone for all of your really thoughtful presentations and chock full of helpful information, and also everyone who participated in the chat and has made it really a lively experience. Those of us who work on this all the time, I'll speak for myself, but it feels like there's a lot of stuff for us to digest, even coming out of the chat and the questions. And if you had a question that we didn't get to, because there were many, please feel free to reach out to us. We're here to provide information on all of this. So do not hesitate to use that link, send an email, however you want to get in the door. We are happy to chat with you and provide additional information. So thanks, everybody, and I hope you enjoy the rest of your day.